I just want to cover some frequently asked questions about miscarriage. Why did I miscarry? Miscarriage is a process, not a single event. Approximately 1 in 5 pregnancies end in a miscarriage. It is often very difficult to give a definitive answer as to why you had a miscarriage. Many studies have shown that approximately 2 out of every 3 miscarriages are explained by a chromosomal problem. This means that when the egg was fertilized by the sperm, the process of fusing together was somewhat faulty, and in many cases gave rise to 1 extra chromosome. A normal embryo has 23 from the mother and 23 from the father. Where there is a problem at conception, this may give rise to a total of 45 or 47 chromosomes. Very often these chromosomal problems are not compatible with life, and nature will determine that these pregnancies do not progress and they will then end in a miscarriage. Occasionally you may have a miscarriage because of an infection associated with a high temperature and a fever, though this would be unusual. Occasionally there may be a problem with the cervix or the womb, an irregularly shaped womb or the presence of fibroids encroaching into the cavity of the womb are associated with a higher chance of miscarriage. Unfortunately, in many cases, we are unable to give a definitive cause. Will this happen again? If you have had 1 miscarriage, it is extremely likely you will be able to go on and have a normal pregnancy. It is important to say that the risk of miscarriage increases as maternal age increases, and also if a woman has had other miscarriages. Even after several miscarriages, though, there is a good chance of a successful pregnancy. Is there anything I can do to prevent a miscarriage? In truth, the answer to this question is almost certainly no. If we assume that 2 out of every 3 miscarriages occur because of a chromosomal problem, then no amount of rest or medication will make any difference to a pregnancy that might already be faulty. There is very little evidence that bed rest reduces the chance of or prevents a miscarriage. How long should I wait before trying again? There's no perfect time to aim for another pregnancy. This may depend on many different circumstances, such as your age, coexisting health problems, etc. It is certainly wise to wait until you have had at least 1 normal period, which usually occurs about 3 to 6 weeks after a miscarriage. Some people would advise waiting until you've had a few periods to allow your cycle to go back into being regular, if indeed they were regular before. Do I need a follow-up appointment in the hospital? Well, in general, most hospitals do not have specific clinics for early miscarriage follow-up. It is probably more appropriate for you to see your family doctor, who will probably know better and who can help you through this very difficult time. It may help to talk things over with your partner, friends, and other members of the family. It is quite normal to be tearful and feel low from time to time, but if you feel that you are getting depressed and unable to cope, it is important to alert your family doctor or indeed the bereavement counseling service at your local hospital. Recurrent miscarriage, which is usually defined as more than 3 consecutive pregnancy losses, is uncommon and affects only 1% of couples. Most couples in this situation will likely want to undergo investigation sooner rather than later in order to establish whether or not they have an underlying cause for their repeated miscarriages. A referral to a hospital or clinic that has an interest in miscarriages is very valuable, since these centers offer the most recent investigations and treatment trials. Also, those in this situation will benefit from knowing they have done everything possible to prevent miscarriage from recurring. Some of my final thoughts are: all women have a right to grieve, whether they lose their babies through early or late miscarriage. Losing a baby at any stage can be a devastating experience. The stages of loss can be a lengthy process as one moves through the stage of acute grief, mourning, and healing. Not every woman grieves following a miscarriage, and some recover quite quickly, emotionally and physically. For others, losing their baby can leave them feeling shocked, angry, empty, and depressed. It is generally assumed that men will take care of their partners. Sadly, it is often forgotten that they have suffered a loss too. Their hopes and dreams for the future have also been shattered. Your grief may manifest itself in a physical way, and the depth of your feelings can be very frightening. If you are worried, maybe talking to your doctor would help. Try not to rush the back to normal routine. Take things slowly and allow yourself the time to grieve for your baby. Physically, you may recover quickly from your miscarriage, while emotionally, it may take weeks or even months to come to terms with your loss. You may have no memories if you lost your baby in the early pregnancy, and this can be heartbreaking. It may be important to make your baby tangible in some way for you. It is never too late to acknowledge your baby. Eventually, you'll become resigned and accepting of what has happened, and although this never completely takes away the emotional pain, you will be able to deal with it in a more controlled way. I understand that this can be very difficult time, so if you have any questions, please join us in the forums at pregnancychat.com. I'm Monica Healy, and thanks for watching.